morning, everyone. My name is Aditi Narayan, and I am Program Manager for LiveStrong Cancer Navigation Center. I feel honored to be here with you all today to share our experience with a community-based patient navigation program. Every day, it feels like cancer hits a little closer to home, and every day I ask myself if I was what my loved ones who I have lost to cancer, what they would have wanted as part of their care. As an administrator for a cancer navigation program, it is quite a powerful question to reflect on, not just from my own perspective, but that of a survivor, a caregiver, and providers. Adopting this multi-perspective lens, LiveStrong Cancer Navigation was founded on the principles of person-centeredness and community. We knew three things going in. One, that cancer care, not just medical treatment, but whole person support, was fragmented, as Dr. Freeman mentioned this morning. Two, that we didn't want to duplicate existing services. And three, we wanted to be dynamic and responsive to what cancer survivors' needs were. With this in mind, we designed the program to be a central hub for survivors and loved ones to access and receive support with physical, emotional, and practical concerns in partnership with best-in-class organizations. Additionally, the program was designed to complement what was offered in a clinical setting. So we were partnered with about 4 other organizations initially. And each of those organizations provided a very specific service. So when someone contacted LiveStrong Cancer Navigation with a financial need and an interest in finding out what clinical trials they could be eligible for, and they needed counseling services, and they wanted to talk to a nurse, we would coordinate those referrals for them so that they didn't have to go and seek those services themselves, thereby reducing the burden. So the goal of LiveStrong Cancer Navigation is to reduce burden on survivors by being their champion and their cheerleader. When someone contacts us via phone or online, our navigators complete a detailed needs assessment to understand each person's needs or symptoms and what their priorities are using a socio-ecological framework. It isn't just about what the patient's presenting needs or problems and symptoms are. It's about the web of causes, because we all know that there's typically more than one thing that's contributing to their distress. So our goal is to identify the root cause of each survivor's pain points, which may be affecting their quality of life, access to appropriate medical treatment, and treatment outcomes, and address these barriers in a timely manner. LiveStrong navigators are equipped to assist with financial and insurance concerns, clinical trial education and matching, education about a diagnosis or related treatments, identifying local resources that may be beneficial, such as home cleanings, meal deliveries, access to emotional support, and education about iatrogenic infertility and facilitating access to fertility preservation. In fact, the highest need that most survivors contact us for is for fertility education and preservation, followed by assistance with insurance and debt relief. So in 2016 alone, we served 9,653 cancer survivors and loved ones, of which over 2,600, we helped them save over $11.2 million. In debt relief, cost of living, and fertility preservation. In addition to helping survivors address these concerns, we also aim to help survivors feel empowered to ask questions of their providers and express their personal goals for care so that they can get the most out of their treatment and their cancer journey. For example, when John came to LiveStrong after recently being diagnosed with brain cancer, he said he wanted to know how to seek a second opinion because the first doctor he went to said that he would never be able to run again. For a serial marathon runner, that was heartbreaking to hear. We helped him learn how to express his personal goals to his doctors so that he could make decisions and act as a team. Shortly before he started treatment, John actually wanted to run a marathon that would help qualify for the Boston Marathon. And it was a high priority to him that he get to be able to do that. And I'm very happy to say that today John has completed the Boston Marathon. Over the last 13 years, our service delivery model has evolved. I mentioned earlier that we used to partner with 4 different organizations in an effort to reduce the burden on cancer survivors. After closely listening to cancer survivors, we found that that experience was actually a little confusing to them, because while we were trying to coordinate care for them, they were hearing from 4 or 5 different organizations, and all they wanted repeatedly was one point of contact. So each time that we have evolved the program, we've had a goal of improving quality and reducing the fragmentation of care. In 2012, we conducted a study to understand the impact of LIVESTRONG Cancer Navigation on specifically the counseling arm of the program on emotional distress, self-efficacy related to obtaining support and coping with emotional health, and overall satisfaction with the program. 874 cancer survivors participated in the study, and the results revealed that the mean distress scores significantly decreased from intake to 6 weeks post, and mean self-efficacy scores increased between intake and 6 weeks post. Also, overall satisfaction with the program was very high. It is important to note that the service delivery model has changed since we conducted the study in 2012. We no longer partner with those 4 different arms, and we no longer provide direct counseling services, but we do make referrals and help facilitate direct connections to counseling. Additionally, after hearing from survivors that they wanted a more streamlined experience, we've continued to try to evaluate how can we continue to give them that experience and ask them to respond to surveys in order to get their feedback. In 2015, we adapted the FACT-G to help measure the impact of our services on health-related quality of life. However, after we piloted the surveys for a couple of months, we realized that a lot of the questions didn't apply to the program, and survivors were having a hard time answering those questions. So we determined that it was not applicable, and in June of this year, we reassessed the program's evaluation goals themselves to measure the impact of services, specifically on reducing emotional distress and financial distress. So we have adapted the NCCN distress thermometer and the comprehensive score for financial toxicity and use post-intake and post-service surveys in order to achieve this goal of measuring this. And we are still in the very early stages of data collection for this. As with any program, we have experienced challenges in strategic and operational management. One of the challenges we experienced or continue to experience is determining the appropriate scope of services. As we continue to learn more about the short and long-term impact of cancer on emotional, financial, physical, and spiritual aspects of survivors' lives, it is important that we adapt our program to meet their needs. However, like many of my colleagues have expressed today, we sometimes experience resource limitations. So it becomes difficult in order to prioritize the changes that we would like to make to our programs. Additionally, in 2010, we piloted an in-person service center that individuals in the community could come to in order to access support. While the community needs assessment revealed that cancer navigation was needed, we did not share Kevin Costner's experience in Field of Dreams of "If you build it, they will come." During the 5-year pilot period, we found that while support services were needed in the community, we had overlooked the transportation barrier. Public transportation in Austin is not very good, and it was difficult and challenging for survivors to make the time and take the energy, really, to go out of their way after they had attended treatment to now come seek services and support at a different location. Convenience is an essential customer service driver and is even more valuable in healthcare. We also struggle with reaching vulnerable populations. While we serve many people with low household incomes, we continue to test ways to reach ethnic minorities and recognize the need to expand our language skills beyond English and Spanish. So we've talked a little bit, or my colleagues have, about technology and the role of technology in patient navigation in cancer care. With the digital revolution showing no evidence of slowing down, we are investing our time and resources in leveraging technology to increase access to and utilization of supportive care in a timely manner. We are also seeking to increase patient engagement through web-based interactive tools and increase their sense of empowerment. Thank you.